Kreena, can you just introduce yourself, please?
Yeah, so my name's Kreena Patel. I'm a specialist in endodontics. I work in South London and in Reading as well.
Brilliant. So you've been using the Dyson HEPA Cool system for a couple of weeks now. What have been your first impressions?
So my first impressions are I really like it. I've had another air purifier that it replaced when I got this one, and I much prefer it compared to the old one that I had.
Why is that? What is it about the Dyson unit that you prefer?
So firstly, I really like the design of it. So I find it quite sleek. It's very narrow, so it fits into the side of my surgery really neatly, and it looks really nice. So when my patients come in, they quite like it. I also like that it's quieter. So my old one was quite loud, and this one is definitely a lot more quiet. I also like that it rotates. So my old one was sort of a standstill one, and this one sort of swings side to side. So I feel like it just filters the air better, to be honest, because of that function as well.
Yeah, definitely. So how does the look and the style of the Dyson unit blend in with your surgery?
I think it would blend in with most surgeries, to be honest, because it does look quite sleek just in itself. Yeah, but for my surgery, I mean, I really like that it's narrow, because my old one was like a round one. I think most of them come in that sort of design, and it was quite bulky, so I had to sort of fit it in the corner of the surgery, and I felt like it wasn't as effective in the corner, whereas because this one's so narrow, I can sort of put it quite close to my chair without, and it fitting in quite nicely. So I really like the design of it.
Great. And how easy is the system to use? Is it pretty intuitive?
Yes, I'm terrible at reading instructions. So when I opened my box, I didn't actually read the instructions. I literally just sort of assembled the parts, and it was super easy to put together. So you can imagine me with IKEA furniture. I'm terrible. I don't sort of read anything. But it was really easy. You just literally open the filters, and then you just pop them into the base of the unit. And as far as I'm aware, even in terms of the maintenance, it's great, because I think you just need to replace them once a year. From what I've read, and even if it's a 12-hour use per day, it's sort of a once a year thing, and it tells you on the app when you need to replace them. So literally it's idiot proof, which is what I quite like.
Brilliant. And how long does it take to have a noticeable impact in the surgery?
So I mean, I guess straight away, in the sense that I usually use it on an auto mode. So when it's on, it basically just initially was in a slightly higher power mode, and you could hear it a little bit more, and then it goes really quiet. I quite like it because I get hay fever as well. And so I feel like it takes out a lot of the allergens in the surgery. So I noticed that actually my hay fever improved since I've got it in the surgery. I also like that, I mean, for example, if you spray, if you're cleaning the surfaces and you spray something on some of the surfaces, you'll notice that it ramps up the mode immediately. So it takes out a lot of the smells, and I think a lot of the chemicals actually within the surgery space immediately. So I really liked it.
The patients have made some comments about the Dyson unit. What is their impression? What have they said, and why is it also important to have something like a Dyson unit for the patients?
So a couple of patients, I think you notice that their eyes go, for most patients, you notice their eyes sort of go to it. But I've had a couple of patients that have actually commented saying, oh, it's nice you've got like an air purification unit there. I think the thing with the Dyson is it looks so sleek that patients actually notice it, because it is swinging from side to side. And I think generally that makes them feel a bit safer, especially with COVID and everything like that, the surgery's doing everything they can to make the patients as safe as possible in the environment that they're being treated in. So a lot of them have a few of them have said, oh, that looks nice. And then a few of them have said, oh, it's really good that you've got that unit. So I think it's just that safety in their minds, maybe not even if they comment, but just that the fact that they've seen it, and, I think it makes everyone feel a bit safer, especially with what's going on.
Yeah, definitely. And does it make things more comfortable in the surgery, not just for the patients, but for yourself as well, because it helps with the temperature of the room?
Yeah, definitely. I mean, we've got an aircon unit in the room itself, so we haven't noticed it so much in terms of that side of things, because it's summer at the moment, so it's quite warm in the surgery anyway, so we've had that on. But yeah, I think just in terms of clinician safety, you feel like, in dentistry, not regardless of COVID times, we use a lot of chemicals in the surgery. So for me, I've constantly got hypochlorite out, and the smell of that, it's nice if you're, having that sort of thing filtered away. You feel a lot safer just within your own working environment. So I think that is also really nice. I have noticed actually that my surgery used to smell of hypochlorite pretty much the whole day from patients coming in and out, because I use so much of it. Whereas now actually you sort of walk back into my surgery after a treatment and you don't smell too much. So I do really like the fact that it's sort of filtering out, and a noticeable improvement in that side of things as well.
Oh, that's great. That's great that it's having such a quick impact on your surgery. So you mentioned about the maintenance. What is the maintenance like, and cleaning it down? How easy is that?
Yeah, so I've recently got the unit, so I've not had to maintain it at all at the moment, but I have read these instructions and it says that basically it's not like other units where you have to hoover the filters or wash the filters, which is normally on a monthly basis. For the Dyson unit, you don't have to do any of that. It's literally just replace the unit filters probably once a year, and that's based on a 12-hour a day use. And we don't have our unit on for that long for sure. So I think for ours it would last even longer. And the process of replacing is quite easy. You don't have to remember it, because you've got an app that comes with the unit. It will just tell you when the filters need replacing. So I think that's quite good from a cost-effective point of view if you're not using your surgery every single day for that length of time. But also it just makes things really easy to remember.
Yeah, definitely.
I really like the app actually, because the unit comes with 2 remotes. So one of the remotes is kept with our unit, and then the other one's kept so I can turn it, that I can increase the power if I need to when I'm there. And it also has an app system, so you can see exactly what it's done in the day, and how much filtration has actually happened, which is good.
Brilliant. Yeah, that's really helpful. So would you recommend the Dyson unit to other dentists?
Yes, I definitely would. I really like it. I also may buy one for my other practice where we've got another unit. So yeah, I definitely recommend it.